Have you ever wondered how a fetus survives for 9 months without breathing through its lungs? How does oxygen reach the baby and what happens to the blood flow before birth? The answer lies in the fascinating concept of fetal circulation, and let's discuss this. The major organs that fetus has, as we already have, are the brain and the heart, and they are the most vital organs in the fetus which requires oxygenated blood. Richly oxygenated blood from the placenta should reach the heart and brain through the carotids and the coronary artery. Now we will discuss the oxygenated blood pathway as well as the deoxygenated blood pathway in the fetus. So first I am going to draw this. Yes. So this is the placenta of the fetus. And this is the fetus का liver. This is the heart of the fetus. This is the right atrium. This is the right ventricle. This is the right atrium, left atrium, right ventricle, and below left ventricle. Now, what happens that this placenta gives a branch known as the umbilical vein, which carries the oxygenated blood to the fetus. Okay, so this is the umbilical vein. Now this is the inferior vena cava or IVC. Okay. Next, the liver has one vein, which is the main portal vein, then right portal vein, then left portal vein. So this umbilical vein joins the left portal vein. Okay, and this right portal vein goes down and gives branches like splenic vein and the superior mesenteric vein. Next is that this blood through the umbilical vein is also getting shunted to the inferior vena cava, and this is known as the ductus venosus. This is the shunt system which transfers the blood from umbilical vein to the inferior vena cava. Now when this umbilical vein joins the left portal vein and then the main portal vein, they becomes the hepatic vein. This hepatic vein again opens into the IVC. Okay. Now this is right atrium, this is right ventricle, and we also know that this is inferior vena cava. So we also have the superior vena cava, which carries the deoxygenated blood from the upper half of the body. Now we already have one foramen here, which is known as the foramen ovale, and this shunts the blood from the right atrium to the left atrium and then the left ventricle. Also this blood goes to the right atrium also, and because through the right ventricle pulmonary arteries emerges, and these pulmonary arteries are not going to carry the blood because the blood is in deoxygenated state, and the systemic and the pulmonary vascular resistance is very high. So here we have the aorta. Okay, so the blood from the left ventricle enters into the aorta, and the pulmonary arteries here. So these are the pulmonary arteries, and these pulmonary arteries are having a connection with the aorta through one shunt known as the ductus arteriosus. And before the arrival of the ductus arteriosus, three vessels, namely the vessels for the heart, that is carotid artery and your coronary artery and the arteries for brain, arises. Now this aorta goes down divides into iliac arteries, and then there is one vessel that arises known as the umbilical arteries, and these umbilical arteries enters into the placenta. Okay, so this is I have made it very abnormal, so you just remember this, like, so there are 5 shunts you should remember. First one is the placenta, which has the umbilical vessels, and then ductus venosus, then the next shunt is foramen ovale, then ductus arteriosus, and then the umbilical arteries. Now coming to the percentage, so the umbilical vein, so we will revise it again. So the umbilical vein has 80% oxygenated blood. So the oxygenated blood in the umbilical vein is 80%, and this blood is divided into 2 parts, that is 80% and 20%. 80% blood goes to the left portal vein, and the 20% blood goes to the ductus venosus and then into the inferior vena cava. And when it joins the portal vein, the main portal vein is having an oxygenation of 27% only. So the oxygenation is getting reduced. So here the oxygenation is 80%, here the oxygenation is 27%. And because here this is the inferior vena cava, 20 to 25% of the umbilical vein blood is shunted through ductus venosus to reach the IVC, and the blood oxygenation, so the shape is just like a trumpet. So the blood velocity in the umbilical vein is 16 centimeters per second, which is increased to 65 centimeters per second in the ductus venosus, and when it reaches the IVC, there is laminar flow, that is the IVC blood flow is slower in velocity, while the ductus venosus blood is having a velocity of 65 centimeters per second. So higher velocity flow and lower velocity flow creates a laminar flow, and there is no mixing of oxygenated and deoxygenated blood. So in this, for ductus venosus, the oxygen saturation is 67%. Now the oxygenated blood, we know that reaches the right atrium and combines with the deoxygenated blood. So the IVC has a deoxygenated blood of around 26%, and deoxygenated blood from this SVC and IVC drains into the right atrium and drain into the right ventricle, and here the oxygenation is 52%. Now high flow oxygenated blood from the right atrium reaches the left atrium. So because this is the high flow blood and this reaches here, so the oxygenation here becomes 65%. So in the right atrium, the right ventricle, the oxygenation is 52%, while in the left ventricle side or left side, the oxygenation is 65%. And this then leads to the blood into the aorta and entering into the carotid and the coronary arteries. Now what happens to the deoxygenated blood? So the deoxygenated blood, that is 52% in the right ventricle, has to enter into the pulmonary arteries. But the thing is that the blood from the main pulmonary artery does not enter the left and right pulmonary arteries, and because of increased pulmonary vascular resistance, and after the 3 neck vessels have been given through a shunt called ductus arteriosus, due to low vascular resistance of the placenta, blood from the aorta enters the common iliac, internal iliac, umbilical arteries, and then the placenta. And 5 adaptations I have already told, that is placenta, ductus venosus, foramen ovale, ductus arteriosus, and the umbilical arteries. Now there are certain changes at the birth, that how it happens that when the baby is not having a breathing capacity, just after delivery these shunts blocked, and then baby is able to take the breath. So when there is delivery of the baby, then there is sudden fall in the temperature of the surrounding, that is labor room, and it leads to the contractions of the Wharton's jelly. Wharton's jelly is the jelly that is present in the umbilical cord, and when this jelly contracts, there is also constriction of the blood vessels in the umbilical cord, and blood flow is reduced in the umbilical vessels of the cord. Then we have to clamp and cut the cord, and few breaths of life, and then this leads to mechanical expansion of the lungs, which increases the pressure of the oxygen, and the pulmonary vasodilatation is there, and there is decrease in the pulmonary vascular resistance. So the blood flow cut to the umbilical vessels leads to functional closure of the ductus venosus. Decreased peripheral vascular resistance leads to decreased right heart pressure and increased blood flow to lungs, resulting in increased blood flow to the left atrium, increase in the left atrial pressure, and functional closure of the foramen ovale. High PO2 and high prostaglandin leads to constriction and closure of the ductus arteriosus. Now there are now look at this diagram. So here you can see that the this is the placenta, and the placenta is carrying the oxygenated blood with an oxygen saturation of 75% to the liver, and it joins the left pulmonary vein to continue as the main pulmonary vein, and then the hepatic vein, and the ductus venosus carries the blood to the inferior vena cava, which is directed due to higher velocity through the foramen ovale into the left atrium, the left ventricle, and then it goes into the aorta, and after giving the branches to the brain and the heart, which is the vital organs and need more oxygenated supply, there is joining of aorta to the ductus arteriosus, that is main pulmonary artery is joined, and then aorta goes the branches like umbilical vessels. So this is the physiology that happens in the fetal circulation. Now there are certain ligaments that forms through these structures, that is umbilical cord forms the ligamentum teres, ductus venosus forms the ligamentum venosum, foramen ovale the fossa ovalis, ductus arteriosus forms the ligamentum arteriosum, and the umbilical arteries forms the medial umbilical ligament. So these are the changes that occurs in the fetal circulation, and this circulation is very important to learn.